Look at that.
Here we are.
We're live. We are live, everyone. Welcome to the newly updated CASAA advocacy update live. Now we're doing it live, Alex.
We're live.
We are officially live. We're going to take just a real quick, brief, like 2 seconds here, and I just want to know how we sound for everybody out there on the interwebs. Let us know in chat really quick if we sound good, if everybody can hear us okay, see us okay. We just want to make sure before we go through all of this that everything is crystal clear for you guys. I guess while we're waiting on some feedback from chat, though, Alex, how's your day going?
It's going well. It's Saturday. It's I think somewhere between 40 and 50 degrees out. Sunshine, you know.
Yeah. Well, we're both in New York, so weather-wise, I feel like I probably already knew that. But I'm glad that you're having a good day. Yeah, I'm really excited for this coming week here in New York because we've got some 60-degree days on the horizon. That's what I'm.
That'll be nice.
To. Yes, that's what I'm looking forward to. Sunshine, lots and lots of sunshine. But yeah, everybody in chat right now sounds great, sounds fine, awesome, fantastic. So then we can kind of jump right into this right out of the gate before Alex gets into all the legislative goodness. I think that we should take the opportunity to highlight some CASAA news, some board of director news. I would like to personally congratulate Danielle Jones and her new presidential position here at CASAA. I think that's wonderful, and I couldn't imagine anybody else in this position right now.
Danielle is already an excellent add to CASAA, and I'm excited to be working with her, to continue working with her in her new capacity. So yeah, it's great to have her on board, and I think worthy of note that all of the graphics and intro material for this live podcast was put together by her, much like all of the other wonderful looking things that you see on our very useful website. So thank you, Danielle, and it's fantastic to have you moving up in the organization and taking a leadership role, even more of a leadership role. So
yeah,
and Danielle's then I guess
fantastic.
It falls on me then to congratulate you.
I don't need a congratulations.
Well, condolences then. I'm sorry. I'm sorry that we've brought you into this mess.
Thank you. I'm just happy to be part of this stellar team of incredible people, advocates. It's just like we've talked about it. I talked about it on social media. It's just an honor to be part of this, and I'm happy to help and happy to do what I can.
We've got two birds with one stone here. So thanks to Danielle for all of the graphics and some of the video editing work in the intro, and thanks to you for bringing all of the necessary energy to breathe new life into the CASAA podcast. So this is wonderful, and I'm glad. I'm excited that you're here, and I'm excited that we're doing this production. And thank you for all of your work.
Yeah, absolutely. I just think it's really cool. I mean, this day and age, everything with media and shows and live broadcasts and podcasts, I think it was all something that just CASAA desperately needed to kind of get in that arena, doing these things, being live, having that interaction and that engagement with our members and people who hopefully will be joining really soon now, seeing all of this. So yeah, absolutely. I just think it's something that CASAA needed, and so far it's been good. And a huge thank you to Bruce Nye also for all of his time with CASAA.
Yeah, it's Bruce certainly brought a lot to CASAA, and we're sorry to see him go, but it's good to have fresh energy, new blood. This is something that we need to go through regularly, and it keeps us alive, and it keeps us focused on our mission. So
yeah, awesome. All right, now that we've gotten all the mushy gushy lovey dovey stuff out of the way for the board of directors here at CASAA, I think it's time. This is kind of the first part of the show here where we really just hand the floor to you, Alex, to to let us know what is happening right now legislatively. What is going on this week? What do we need to know?
Sure. So I got a brief update, some words about Connecticut, some bills in Illinois, Texas, and Minnesota. This is not an exhaustive list of everything that's going on next week, but these are what we have kind of prioritized here. Also Washington State. Just some brief words about Connecticut. The flavor ban bill, as some might know, has moved through the Health and Human Services Committee, I believe, with a favorable recommendation. And this is something that I think will ultimately be part of maybe the budget proposal there. I'm hearing sort of mixed things about it. So it doesn't quite have the same amount of support that we thought it did at the beginning. And so that's relatively good news. I'm short on details. I just kind of wanted to give folks in Connecticut a bit of a note about that. But we are following it. And when we get the word that the engagement is needed, or when we determine it for ourselves, we will put out a call to action. But at the moment, we're still there's still a lot of temperature taking going on. So that's relatively good news. Moving right along to Illinois. Illinois has an indoor vaping ban, and I'm going to do my screen share for the folks watching the live. Here we go.
Look at that smooth transition to the CASAA website, everybody. Look at that.
I apologize for the narration, but sometimes it's necessary to fill the dead air. So all you have to do is,
listeners,
for anybody looking for a call to action in their state, or if you want to find information about your state, get involved is the word or the tab that you will look under, state and local. I am narrating this for the benefit of the folks not seeing us on the YouTube. So, and here we are, the state of Illinois. So there is a public vaping ban that would prohibit vaping in the same places where smoking is banned. And the hearing, we put this up last week, I think. The hearing was either extended or moved to March 23rd. It's the same committee. We've updated this. Sending in witness slips is the way for people to participate. There are lots of steps involved, but don't be intimidated. It will come to you naturally once you get there and start reading things. And creating a witness slip is actually pretty easy. So if you live in Illinois, take a moment to fill out this witness slip prior to the hearing on Tuesday, March 23rd. The other thing in Illinois that we don't have anything up for, it just recently got introduced. This will be HB 4050. And this is a flavor ban. It has an exemption for menthol, but this was just introduced, so we're keeping tabs on that. Another bill that does have a hearing on March 23rd, we don't have an engagement up for this yet, is HB 2579. This would propose a 25 milligram per milliliter nicotine cap. And we can get into a larger discussion about that if we really need to, but I think it should suffice to say that CASAA does not support imposing nicotine caps on e-liquid, especially given all the variety of devices that people like to use, and smaller devices need higher nicotine concentration. And a little note about, I think, one of the articles that we'll be discussing later on. The HB 2579 would also prohibit anyone under the age of 25 from selling flavored vapor products. So if you have young adults between the ages of 18 and 21 working in your shop, they would not be allowed to sell flavored products, and you probably wouldn't necessarily want to keep them as employees. So if you value your young employees, that might be a bill that you're interested in. Also, making sure that people have the right nicotine concentration. So moving quickly along here to the great state of Texas. We have I have an update here. So we are really just tracking legislation at this point. One of the interesting things about Texas is that given the fact that it is geographically a very large state, you tend to have multiple bills filed sort of addressing the same thing from all corners of the state. So we'll see a lot of this, and then we'll see them start to move. So right now, the update is for SB 836. I added this to the list. This was recently assigned to the Committee for State Affairs, which is also looking at some other similar legislation. The companion to SB 836 is HB 3842, for those of you who are playing the home game. So right now, we're just keeping tabs on it. And if you want more information about each one of these bills, we have links to them all on our website here. And of course, it is always a good time to reach out to your lawmakers to express your concerns or opinions about a particular bill or issue, and you can do that right here. That's really just looking up their contact info. We're leaving it to you to use your own words, but we provide that as an easy resource.
Look at that, CASAA providing easy resources for consumers to speak up. I love it. I love it. Fantastic.
The more voices, the better.
Absolutely. We got to get loud. We got to get loud.
Moving to the next one will be Minnesota. I don't know that this has gotten a whole lot of attention, and it's just here. I want to make sure that folks in Minnesota are aware that we do have 2 calls to action up for a vapor tax. This would tack on, I believe, an additional 35% retail tax. For those not in Minnesota, you may or may not know that Minnesota is the first state that enacted a tax on vapor products at 95%. The way that it was worded, however, gave manufacturers a bit of a workaround in that that tax, because they're ordering in the nicotine, the tax is only on the nicotine. So they're paying 95% of the wholesale cost of just the nicotine. It kept prices down so that state products manufactured in the state were not wildly expensive, but folks in Minnesota didn't really have the access that a lot of the rest of us do to out-of-state liquids, because they're paying that tax on the whole bottle. So this would add an additional 35% at retail. And there's a couple bills involved here. You have HF 991 and SF 961. And we also link to an article on reason.org talking about a study which found that the 95% wholesale tax on nicotine, even though it was managed to be kept a little bit lower, discouraged something like north of 30,000 people from switching to vapor products, that's a pretty big number. So that is Minnesota. The one bit of warning, I think, here was that it might be the flavor ban, actually. I'll go back here. Okay, I'm going to do this quickly. It's so easy to navigate the site.
I just love that you're giving live navigation tutorials right now. Yeah. This is my favorite thing about all of this.
I think this was the HF 904. If you want, you can check the meeting minutes here. But I think there was an article about this that this could just end up in an omnibus bill. For those not familiar with what an omnibus bill is, it's an everything in the kitchen sink piece of legislation that usually goes for a budget. And so it's once individual bits of legislation end up in an omnibus bill, it gets kind of challenging to pick out the parts that are really bad. So this is a heads up about watching Minnesota's budget bill as it goes through the process. This budget processes vary from state to state. Everybody's kind of got their own flavor of how they do this. So I am not going to claim to be an expert in how this works, and we encourage people in Minnesota to research it and try to track it the best you can, because if you're relying on us to track your state's budget, that may be something that falls through the cracks. So big heads up here.
Reminder too, like New York, where you and I both are, our flavor ban was imposed on us through a budget bill.
Yeah, a lot of really bad stuff has been enacted through budget bills. For example, the shipping ban that we're all facing right now. That was something that squeezed through rather rushed. There was not I don't recall any debate about that particular piece of legislation. And so, yeah, it's a great way to sneak stuff through, and that's why they use it.
That is absolutely why they use it. Yeah. All right.
The last one, and I just want to make sure that I'm not sharing my screen for this because I have to go into my emails.
Oh, we don't get all the nitty gritty Alex emails? Well, that's okay.
There is a bill in Washington State. We also don't have an engagement up for this yet. There's a lot of work going on the ground in Washington State, and so that we work collaboratively with state groups so that we're not angering lawmakers who might be having constructive conversations with folks on the ground. But just so people are aware, there is a hearing, I believe, on the 23rd. Yes, at 1:30 p.m. And this is for HB 1550, 1550. And this is a 45% retail tax. And this would be on top of the existing sales tax of 10%. So all told, I'm sorry, I missed a number here, and a 4.4% wholesale tax. So yeah, a lot of extra taxes being proposed in Washington State. There is a hearing on the 23rd. That's Tuesday, right? And
yes. The 23rd will be Tuesday.
And yeah, I believe myself and some other folks will be testifying against that bill.
Fantastic.
So that is my whirlwind, well-timed legislative update.
I want to take a minute just to commend you on how swimmingly you just went through all of that legislation.
Thanks.
Yeah, fantastic. I hope everybody got all of it. But if you didn't, obviously, calls to action that we do have posted are right up on CASAA.org. And then, like Alex said, some of this stuff will be rolling out here soon as well. Fantastic. Well, most of that's not fantastic. Most of that's, a lot of, I don't know how to word this, de-incentivizing people to switch. But that is what these calls to action are for everybody, so that way we can get ahead of these things and try to turn the situation around. Do you want to quickly and briefly talk about the call to action for the National Vape Mail Ban, considering our short timeline here for people to submit comments? Do you want to roll through any of that for folks out there who maybe haven't submitted yet, where they can go for that and what that call to action looks like?
Yeah, so we're here at our National Calls to Action page. Look for the USPS Vape Mail Ban. Comment period is open. And the deadline is Monday. End of business Monday. I think technically you have until 11:59, but I'm not going to encourage anybody else to wait for the last minute to submit something. But if you're new to the site, get involved nationally and check out all the details we've laid out here. You've got a bit of the timeline. As we mentioned, this was something that was just shoehorned into a massive budget bill and was passed in 2020. We'd had that year.
2020 happened.
Yep. So there's some details here. Some of the points that we think are going to be important, possibly for consumers to comment on, and of course, acknowledging that our folks come from a wide range of expertise and interests, and so plenty of potential there for people to write very meaningful comments. And one thing I want to reemphasize is write your comment. You never know what the USPS or any agency has deliberated in terms of asking themselves all the questions. Where could this go wrong? Where do we need some more clarity? You may have, and you may not know it, but you may have some thoughts that they have not considered. So it's very important. And of course, if you feel that all you have is your story and how important switching to smoke-free products is for you, that is also very important. We need to be able to look back on this comment period and demonstrate the tremendous value that not only these products have, but being able to ship them, being able to get them in people's hands easily. And so that is something that will feature prominently, possibly. It may feature prominently in future work to fix the rules. And so that's why we want to get as many people to comment on this as possible. And Danielle, again, has done a lot of work to make sure that this is very simple for people to follow. And also down the page a bit, note there are two things that we're asking people to do. One is of course sending your comment, and the second one is sending a message to your lawmakers and letting them know your thoughts. We've pre-written a message here, but you're free to delete that. Certainly add your own, whatever you'd like to do. And of course, our system is not set up to do this automatically for people outside of the United States. So we've included all of the contact information here at the bottom for sending the email, and definitely make sure that you have in your subject line e-cigarette restrictions. So that's the tour of our call to action, which you can find at CASAA.org.
Oh, there we go. We have a question in chat here, and I think it's really I think this is a relevant one. Do we know how many comments have been submitted on this issue?
Ordinarily, when we have something, because we to the Federal Register or like a regulations.gov type of thing, there is that, you do get that feedback of seeing how many people have commented. This is different. This is going to just an email. You're just sending an email to the USPS. So it's not being tracked through that same system. I have not actually investigated this question. I'm one of those people that's like, we're going to go all out and get as many people as we can, and then we'll figure it out when we're done. Yeah, and I don't want to take
answer is hopefully a lot. That's my answer. Hopefully a lot. Hopefully everyone. Hopefully everyone.
So
yeah, good question.
All of that to say, yeah, good question. I don't have the answer right away, but I will see if we can find that.
Perfect. All right. I also, really quick, I did want to highlight for people who may not know exactly what to say. Alex kind of briefly went through some places right there in the call to action for talking points and stuff. But you also did a webinar recently. Do you want to talk about that? Who that was with, and what kind of the key points, key takeaways from that? There's also a part of the blog post that talks about that webinar as well.
Yeah, this was in collaboration with the American Vaping Association, Gregory Conley, and Paul Blair, formerly with the Americans for Tax Reform, now with Turning Point Brands, and another gentleman whose name for the second week in a row I have failed to research and I don't remember, but he was certainly one of the legal minds, part of looking at the rule and where people can comment. So yeah, I strongly encourage it. You know, other than myself, you had some folks with a lot of industry experience. The blog post, I'm sorry, the webinar was for the most part geared toward businesses. So if you are in the vapor business, definitely check it out. There's some good pointers, and like I said, from all sides of this, the more comments, the better, because there's no way that USPS has thought of everything. So as a small business owner, you're certainly facing unique issues, unique challenges compared to a company like Turning Point Brands or Altria or Reynolds, larger companies. Actually, when we start talking about the large incumbent tobacco companies, they don't rely on USPS. They don't rely on UPS or FedEx or private shippers necessarily, unless they have some sort of massive agreement worked out with them. But they have their own. They've got their own logistics. They can do their own shipping and stuff like that. So the small businesses here are the ones that are really getting the raw deal. And of course, just multiply that, I guess, by whatever number, and that's the raw deal that consumers are getting. But certainly every link in the chain is affected by this. So check out the webinar. It's a good resource with some good folks.
Fantastic. Yes. Awesome. All right. I think that's going to do it kind of for our legislative roundup, as Alex always refers to it as the legislative roundup, which I just love. Yes. Excellent. Man, I'm still kind of taken aback by how just well you did that, and we didn't go off the rails. Jim would be proud of us. I feel like Jim would be really proud of us.
Yeah, well, I guess that's the difference a day makes, right? Like, it's Saturday, so.
Yeah, that's true. We normally would be recording these on Sundays, so maybe it's just that Saturday energy that you have now. Yeah. Oh, you're also not distracted by cars making left-hand turns right now.
Yeah, no, I'm focused. So, I'm here to play.
Normally, for people who have watched or listened to the podcast, it's always race day when we're recording. So sometimes there's some NASCAR discussion that happens in there. But moving right along into the rest of this week's blog and what we have going on at CASAA. For anybody, I know Kristen, thank you, who's in chat right now, sharing all sorts of links for people who want to kind of follow along with the stuff that we're talking about. So thank you, Kristen. But you want to talk about INNCO?
Yeah. So INNCO has, well, for those who don't know the acronym, INNCO stands for the International Network of Nicotine Consumer Organizations. And they have released a response to growing pressure on low and middle income countries to ban vapor products completely. And a lot of this is going on in Southeast Asia. And yeah, it's the term associated with all of this is philanthropic colonialism. And I'm not going to go too far into this because we have a video to share.
We do.
And we'll let the video speak for itself. But we got about 5 minutes here, and I'll cue it up a little bit for folks who are listening to this later. You can find this on our YouTube channel, or you can find it on INNCO's. I like to make sure that the appropriate folks get the likes and the views. Yeah, this, if we're ready, I can play this.
Absolutely. Before we do that, can I just hear you say philanthropic colonialism one more time?
Philanthropic colonialism.
All right. Cue the footage. Roll that beautiful bean footage.
Okay. Was that NPR voicey enough?
Yes. That was beautiful.
Excellent. Oh, wait a second. So you're going to have to forgive me. There's some technical learning here.
So the cool kids refer to these as dangle clacks, and I'm sure there's some cool kids here.
I'm not sure what is that strobing for you?
It's strobing for me as well.
Sorry, I think in some places you have to offer a warning about that.
So the video is not
here we go
for everyone. Okay, here we go.
Have you lost someone due to smoking?
Yes, I lost my grandfather.
Quite unfortunately, I lost an uncle name while I was growing up to lung cancer.
Yes, I lost many people, including family members. And yes, and I've seen how that happened in front of my eyes. I've seen how people is dying. as they smoke, and I see them like carrying oxygen tanks and at the same time smoking.
Every year, nearly 8 million early deaths are attributed to smoking. 80% of these deaths are of people living in low to middle income countries. To put that into context, the death toll attributed to smoking in low and middle income countries is double the number of people who have died from malaria, HIV, and COVID-19 combined. In 2020, the union, funded by former New York City mayor and current billionaire Michael Bloomberg, called for a blanket ban on all nicotine vapor and heated tobacco products to the countries that need these alternatives the most. Are safer nicotine products available where you live?
Vaping was banned September last year. A ban never works, right? It's never worked anywhere in the world. So the only thing it did was it drove it underground. And so it's freely available in India, vaping products. Unfortunately, without any regulation of any kind.
Should people who smoke in your country have the same opportunity to access potentially life-saving, safer nicotine products as people living in high-income countries?
Well, yes, of course. It doesn't matter where you live. You know, you are human, right? I mean, we are all human. It doesn't matter. We should have the basic human rights. It doesn't matter if you come from a rich country or LMICs or where, you know, or poor country, third country, first country. We should have the same basic human right.
This union's document, when bans are best, makes, or at least the consequence is that now you have two kinds of human beings, the Class A and the Class B. Class A living in UK, in first world countries, and they have access to safer products. Class B citizens, the ones from low and middle income countries, we are not entitled to have safer alternatives. So our lives are not as important.
The problem with Mr. Bloomberg is that he's a vaping prohibitionist.
And that worries me, that, you know, if people take a moralistic stance on nicotine, then they are denying people who actually need to stop smoking a way out of their smoking habit.
Blanket bans in low and middle income countries are the results of philanthropic colonialism, where short-term funding for coercive and underperforming tobacco control policies is presented to government officials as the only way forward. By virtue of being a top-down policy decision, the people most affected by strict nicotine regulations are excluded from the process. While organizations like the Union and the World Health Organization continue to paint people who smoke as victims of incumbent tobacco companies and incapable of making decisions for themselves, it is the paternalistic anti-nicotine policies that are taking away people's right to choose better alternatives to smoking.
Vaping saved my life.
At the same time, there is a general scientific consensus that smoke-free tobacco and nicotine products are low-risk alternatives to smoking.
It's a product that can transform health. Smokers, not all smokers, but enough smokers to matter, find electronic cigarettes an effective substitute for smoking, and if they make the complete switch to electronic cigarettes, health-wise they achieve pretty much what they'd achieve as if they quit smoking completely. So the challenge is to get as many smokers to try and go down that route, not to start trying to restrict or prevent uptake of electronic cigarettes. They're a game changer. There's no going back from that. The whole market in nicotine delivery has been radicalized by these products. And I just hope that there are more and even more exciting products on the way.
Denying people access to these life-saving options based on income can only be considered discriminatory.
Nothing about us without us.
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 Yes. There we go.
In December 2008.
Oops.
I'll just mute that. Yes. Fantastic. Nothing about us without us, Alex. I think that should echo around the world.
It's an excellent piece, and I just wanted to note the comment that flashed up there from Jeffrey Zamora. Jeffrey helped with, I don't know if he did the entire video production, but he is the unseen, unheard talent at the other side of that video. So thank you, Jeffrey, for all of your work and
thank you, Jeffrey,
making me sound okay. I appreciate that.
I think you sounded great. I think everybody did a fantastic job. That is such a powerful piece. Watching it the first time, like I was instantly just captivated. I was just drawn right in, right until the last second. I still am sitting here watching that when you pulled it up. I couldn't stop. I was over here like fist bump, like fists in the air, like I was cheering on while watching it. It's really a really well done piece and highlights a really big problem that's going on.
Yeah, it's one of those things where I think perhaps it's a bit more, some of the dysfunction in this whole debate is a bit more obvious when you're talking about low and middle income countries. Here we have, our debate in the United States is a bit diluted, I think, and we don't get to really focus so much on low and middle income communities the way that I think we would like to, from a harm reduction perspective. And one of the things that sort of stuck in my mind here in the United States is that these products have a high initial cost. That is enough to discourage somebody who's, budgeting $50 for the week or something, depending on what your economic status is, not just in the world, of course, in your own country, tends to determine how much access you have to beneficial products, good food, good healthcare, even access to your lawmakers is somewhat determined by your income, your zip code, and so on. So it's a bit more obvious, though, when you're talking about an entire country. I think, of course, highlighting the involvement of an American billionaire in crafting another culture's tobacco policy. It's bigger than just geopolitical boundaries. It's how does your society handle issues of substance use? How do they? What's their relationship to tobacco? I think those are much more important questions than simply telling people to believe that tobacco bad and has to be banned. And it's certainly not helping anybody. And it's just more. I really want to get away from referring to people anywhere as victims here, but this is sort of a double whammy. There's a problem in the world with tobacco companies, of course, doing what businesses do. They take advantage of loopholes in the law, and it's not really a loophole. It's just the laws aren't strong enough to prevent them from doing certain things. And specifically, we're talking about marketing practices. And so they continue to do things, and we can't have a real conversation about harm reduction. And it's necessary to kind of push back on the way that they do business in other countries. But unfortunately, because this conversation has become so twisted, and all nicotine products have been associated with tobacco companies, there are people, they've been on the receiving end of manipulative marketing from the tobacco companies, and now they're on the receiving end of coercive and manipulative policy from their officials. So we don't get to have this conversation about how safer products can actually improve people's lives. And that's part of the strategy that we're all up against. It's going to take a massive, this effort from INNCO is, I get chills thinking about it. I think this is great. I hope that this sends the message home where we need people to hear it. But I think the misperceptions of vapor products and tobacco harm reduction is something that's going to take perhaps many years to change minds. I hope living in this technology-driven age that it doesn't take that long. But I just have to add that I think as a not really a caveat, but gird your loins for the long term here. We're not going to be able to solve this overnight, and this is one of the very necessary and very good efforts.
Yeah. One of the things that really, one of the I guess parts of that really like hit me was the gentleman saying, it doesn't matter where you live. It doesn't matter if you live in a rich country or poor country, third world, first world. It doesn't matter where you live. We should all have the same basic human rights. And when it comes to smoking around the world, not only is your autonomy, your bodily autonomy, a basic human right, but having the same access to safer products that other countries have just because of their monetary status. That's like in this film, that's nothing short of discriminatory. It's a violation of human rights.
Yeah, I think probably one of the grossest things about this is that folks like Michael Bloomberg think that they can push people around with their money. He must be accustomed to it, right? Money is a very attractive thing. You can buy your way through all kinds of life, and so it's.
We almost didn't have large sodas, thanks to Michael Bloomberg and him deeming that we are not responsible enough to decide what size soda is appropriate for us. New Yorkers may remember that.
Yeah. Well, at least New York City, right? Did that ever get to a statewide proposal? I'm sure.
No, I don't believe it ever reached statewide proposal. I mean, I'm just glad that it didn't happen, but yeah. And as well as anybody, just because something happens in New York City doesn't mean it's not going to ripple out from there. So.
Yeah, and well, one of the patterns that we've watched over the years, and I know we're bringing this back to an America-centric conversation, but it's still relevant because it's an American billionaire meddling in other countries' affairs. But yeah, there is a pattern. You will see policies like what we've seen in tobacco and nicotine originate on one of the coasts, California or New York, and then it ripples across the country.
Yeah.
Usually, the targets are chosen based on population size. The effort is to get, as many people living under a certain policy within a certain amount of time, and then you can just scale that up and say, now we need a federal law.
Yeah. I don't know.
Course,
would you call that a boiling frog? I don't know as though that's a boiling frog per se, but it's kind of along the same lines.
I mean, it's the nature of the system. So policy and change move slowly. Folks want to be very deliberate about it. There are also sort of hang-ups of old that people need to work through in order to change their minds or compromise. So just, by virtue of a bunch of humans running the process, it takes a lot of time. And boiling the frog is one of those unfortunate side effects. This is, again, something that, the reason why organizations like CASAA were formed was to, push back against all of the things that we are seeing now. The hope was that we would get enough people involved and make enough noise that we get the experts coming in, and the experts are in a really good position to represent, at least the scientific and policy issues that we're seeing, and making it more credible. But timing is what it is, and so now we're at that stage where we're coming up on fully cooked. The regulations came in slow. Kind of this is the boiling the frog metaphor. If you turn up the heat slowly, the frog won't jump out of the water. And so, you know, this started at the municipal level and then moved up to the state level at the same time when the FDA made their first attempt at banning the products. You know, and it has just sort of snowballed since then. And now we're facing what we're facing: the shipping ban, PMTA restrictions, and seeing products going off the regulated market and into more underground environments.
Yeah, exactly. Whenever I think of the boiling frog, I always think of decades ago, you know, anti-tobacco groups pushed for, you know, we just don't want smoking on flights. That's all we're asking for. You know, most people, okay, that's a reasonable request, even though it kind of went against a lot of the science regarding ventilation on planes and things like that. But it was just like, that's all. We just don't want smoking on planes. People went, okay. And that's where it started. Okay, now we just don't want smoking in restaurants. Okay. Okay, now we just don't want smoking in any public place. Okay. Oh, now we don't want smoking on any municipal. That's the boiling frog. You know, as you kind of go along, it progressively gets more and more and more and more extreme. While every step of the way may seem minuscule to some, it's all part of that broader cooking of the frog effect until you get to the end where the frog is fully cooked.
Yep.
Yeah. So for anybody out there who maybe didn't quite understand the boiling frog analogy, that's how I always explain it. Is just kind of that. That's how it goes. That's how it goes along. But yeah, fantastic stuff. Happy to hear Mr. Alex Clark in that as well. He did a fantastic job. And again, big thank you to Jeffrey and just INNCO for doing all that they do. Fantastic stuff. Tyler's got a question from the YouTube chat. He says, another question. My senators have already come out in favor of flavor/shipping/all-out vaping bans. What can I do, or the rest of us for that matter, do to change that? Is it worth emailing them? I'm going to preface that with it is always a good time to reach out to your lawmakers and you know, voice your concerns. But I'll let Alex, I guess, kind of take it from there.
Yeah, well, I should be quicker on the draw here in finding our contact your lawmakers page on our website, but we do have, of course, like we showed in the USPS, or some of the state level engagements. There are. You'll find at the bottom.
Up your screen for you.
Yeah, thanks. But I know we have it, and I'm just not prepared. But anybody, you could just, the advice is really familiarize yourself with your state's website. There's usually a tool to find your lawmaker on there, yeah, it does matter. It does help for people to regularly contact your lawmakers. You know, we on our blog here, we're posting research, we're posting articles, and especially when it comes to research, it's something that, you know, if you can just provide a little bit of context for why you're sharing that article with your lawmaker, that'll help them understand it, understand, you know, why it's relevant to this issue. Lawmakers sort of, you know, claim that they want to hear and want to consider all of the science. In practice, it's really, they're kind of getting briefings about this from staff and from activists, unfortunately, who are not giving them the full context. And, you know, I think if there's any significant reason why people should contact their lawmakers, no matter what you know or think their position might be, it's that, just like one of our criticisms of the USPS shipping ban, and one of the criticisms that USPS sort of leveled at Congress, is that they don't understand the products. They don't understand the products. They don't understand the people that use the products, and they don't understand the people that make the products. And that's a tremendous amount. Think of all of the 50 states. You've got 100 or more lawmakers, several hundred lawmakers, depending on the state. There's tens of thousands of people across this country who are deciding the direction of policy, and they don't understand the products that they're regulating. And so having that conversation, even if it's just one way via email, is important. And the more messages that they get, the better. Lawmakers really do need to realize and see people behind, people behind the products that they just have not been given the opportunity to see. They've been met with a lot of confirmation bias and sort of stoking of fears and anxiety about youth use, and it's not providing anyone with an accurate or even a broad picture of what's going on. So yes, write to your officials and let them know how these products have affected you. Hopefully good. More often than not, we know it's been for the better. So share that. I just don't want to tell you what to write. But it's very important for lawmakers to hear. Definitely write them an email and, give them a call too. You usually talk to someone on their staff. Staff they should be eager to listen to constituents' concerns. They're usually very polite. A lot of them are young. So, they're interested. They've got some ambition. They want to do a good job, and it is their job. They're there to listen to you. So take out 5-15 minutes and give your lawmakers a call.
Yeah, it's a perfect response. Absolutely, always a good time to reach out to your lawmakers. Absolutely, always a good time to reach out to your lawmakers. I don't know necessarily. From chat here, Apathy Miller put in, and when the politicians do use the science, they use Stanton Glantz or other anti-science when they cherry pick or use old studies. Absolutely. There's a number of times where they do. And Alex has talked about this in the past where, that's the science they're being given through lobbying efforts and things like that. So it's really important for us and advocates, activists to bring out and expose that. But also visit your reps, give them a face to put to vaping. I think that's the big highlight that I wanted to talk about on this comment. Maybe a little more challenging now in the COVID era that we're living in, but it is absolutely your right to set up meetings with your lawmakers. And I'm sure, I don't want to say I'm sure, but I would assume at this point, maybe there's virtual ways to go about that or COVID friendly ways to go about that more so now. But yeah, I mean, your representatives, your senators, these are folks that work for you, and you absolutely have the right to reach out to them and set up meetings. So that way you can do just what Mr. Miller here said in the comments. Give them a face to put to vaping. Go and share your story. I think that has a lot of impact with folks when you can sit down face to face to somebody and you can explain, look at, I feel much better. My health is improved. And my children here, who I've brought with me to this meeting, the children that we're protecting through these, atrocious policies, these children are very grateful that this technology exists because their father's health is improved. So you're more than able to do those things. I don't know exactly what that looks like now, again, in the COVID world, and that probably varies from state to state and lawmaker to lawmaker. But those are very real things that you can do.
I will add to that, and just to hopefully measure some expectations about meetings. Typically, depending on who your lawmaker is, I know when I lived in New Jersey, it was impossible to get a meeting with like Frank Pallone's office. They just will not talk to anybody associated with tobacco or nicotine industry. But most of the time, since what your state legislature, a bulk of their work is all about money. They are money people. The budget is probably the biggest project that they're going to do every year or every 2 years, and so it's important for them to hear from the money people, which are businesses. And so if you do have a relationship with your favorite vapor shop in town or somebody who is in the industry, and you have you have an important perspective to share, obviously, ask if you can tag along with them in sort of a group meeting. Lawmakers prefer to meet with folks in groups. You get a wide range of perspectives in a meeting like that. And so if they are willing to meet with a group like that, it's definitely worth pursuing, especially if you're going in with a particular ask on a bill. But generally, it's of course, with considering everything that we've just said, it is now, of course, an appropriate time to set up something like that so that they can be educated about the products and the community.
Yeah, absolutely. Absolutely. And yeah, I guess that's a good lead in, though. All of that is a good lead in to, we were talking a lot about Bloomberg, sorry, I'll formulate my thought just a little bit better here. Speaking about Bloomberg and philanthropic colonialism, there was a recent post from Dr. Brad Rodu. I think I said that correctly. Rodu. I used to say it wrong all the time. I used to say Rodu. I think it's Rodu. Correct me if I'm wrong there. But Alex has it pulled up on the screen. This is an excellent post. I guess I'll allow Alex to kind of highlight. He's got it all pulled up ready, and he looks like he's ready to go. So I'll let you take it away.
Well, I will just briefly say, yes, this is a good post. For those who have not read Brad Rodu, he's been in the tobacco harm reduction game for, I think, 2 or 3 decades at this point. Actually, the book here down below for smokers only, that is, I think, one of the earliest efforts in the United States to get people to transition to a smoke-free product. And this came out in the 90s, I think. It has since been updated, but this was, it's got the bonus chapter on e-cigarettes. But this was targeted towards people predominantly in the South who may be more willing to use chewing tobacco or dip or some other smokeless tobacco product as an alternative to smoking. So definitely check that out. But one of the things that he's sort of railing against here is that I don't want to go so far back in the past, but just to bring everybody up to speed, this is all about IQOS, and Altria is licensed to market IQOS in the United States, a Philip Morris product, and they do business through Altria here in the United States. And so this is Altria. Altria reached out to the FDA and I believe asked for some assistance in getting the word out about the modified risk approval for IQOS. It's actually modified exposure, which is very close. And this effort needs to be undertaken as part of some of the observations that FDA themselves have made with regard to public perception of the risks associated with nicotine. And this is a huge issue, not just for vaping, of course, for clinicians, doctors who want to help their patients quit smoking. They want to be able to say, use this nicotine replacement product. But if doctors don't believe that nicotine is not as harmful as smoking, or if they believe that nicotine causes cancer or some other issues, then they are not likely to offer those products to folks who might benefit from them. And so this is a huge deal. I think it was only something like 40% of clinicians accurately believed that nicotine by itself was not a major source of harm. And so Altria asked the FDA for some help with that, and they are sort of met with this response from, I guess, the usual suspects here, condemning the move, I think, and saying that FDA should not get involved with this, and this is the battle we're facing. It is this this sense of self-righteousness that these people believe that they are justified in keeping valuable information from people, all sort of consistent with their mission to conflate the risks of the spectrum of tobacco products, and really the sort of long-term goal of eradicating nicotine use in society, which is really not getting rid of it. It's getting tobacco use prevalence below 5%. So yeah, my summary is not doing this justice, but this is a good short piece from Brad Rodu to kind of dive a little bit more into what's going on with that. So I did just want to mention that quickly. I'm sorry if I took up too much time.
No. I think your I don't know, your spark notes here for this was really good. You know, he kind of just, I don't know. This is like a rebuttal. I don't know what rebuttal is. This is like a rebuttal to that article. And it's just really great. You know, he tackles a lot of the issues with it. And I would highly recommend that everybody goes through and reads it. There's a few little key points that I found interesting. He writes, the article continues. You could pull this right up if you wanted to, Alex. The article continues, quote, the drug has even been touted as a way to ease tension and sharpen the mind, before noting that it is the ingredient that addicts people to tobacco products and has its risks, including possibly making people more susceptible to abusing opioids. And Dr. Rodu's response to that was that tout is a derogatory term meaning to describe or advertise boastfully, given that nicotine conveys many proven benefits here and here, which he's fantastic about citing all throughout all of his blogs. Touting is not required. Still, Bloomberg irresponsibly and inaccurately paints it as a gateway to hard drugs. This is the only part of the article that I wasn't the biggest fan of. Just the idea of hard or soft drugs in and of itself is kind of a fallacy as well. But I really just like the way that he, you know, even points out the use of their language in certain things to show how kind of deep set the way that we're talking about this issue. Little words like tout, you know, just to throw in there, just to. I really appreciate the way that he wrote this and really kind of tore it apart bit by bit, even down to little stuff like that.
Yeah, and you know, Bloomberg is a bit of a drug warrior, so it is not unlike them to rely or invoke drug war tropes. He did that, I think, on the CBS Sunday or CBS Morning News when he appeared with Matt Myers, claiming that the IQ. Vaping would reduce your IQ by something like up to 5 points.
I want to say he said it was up to 10 points would drop your IQ. I mean, there's a whole world of problems with IQ tests in general to begin with, but yeah.
So yeah, it's not uncommon for Bloomberg to pull out language like this, and certainly appropriate to call him out for it.
Yeah, I wanted to thank Dr. Rodu for taking the time to make those little nuances out of there, you know, to take the time to point out the use of their language. Because those are things that people I think a lot of people just kind of skim right past stuff like that, you know, and they don't really give it much thought. And he takes the time to point it out, which I appreciate.
Yeah, words matter.
Words do matter. Language matters. Absolutely, it does. All right. Well, everybody, we're past the hour now, so I think this is where we're going to wrap up this week. Alex, do you have anything? Do you want to do any? Do we have any kind of Q&A? Do we want to do a little segment here where we can pull questions out from the chat? Maybe Kristen has some things for us on the back end that we can pull up.
Sure, I do. I sorry that we went so long, but I want to make sure that we do get in this study that we wanted to highlight. It is sort of at the end of our blog post this week, but this is about vaping and schizophrenia, and again, one of those uses potentially for nicotine that no one has to describe or promote boastfully. It just is. So definitely read that from a post. This is from the Cohere group, cohere.org. And it should, Yeah, so this is a part of a larger discussion here about the utility of nicotine and how it can be used for therapeutic purposes. Nicotine doesn't exist just to help you get off of cigarettes.
Right.
We know that there are uses. This is something I'm sure you can add this to one of those little here links in Dr. Rodu's post. So we won't get into it too much, but it is very important that research continues in this, because folks who are facing mental health issues, mental health challenges, smoke at disproportionately higher rates. And it's certainly specific to schizophrenia. I've heard this. I've never really had a conversation with a doctor about it, but it is my understanding that a lot of folks who have that diagnosis they do turn to cigarettes as a way to manage some of the milder symptoms. Whatever it is, it does help them. And so being able to deliver nicotine in a way that is orders of magnitude safer is something that would be a tremendous benefit to people living with that diagnosis. And
just to highlight some of this really quick from this article, like you were saying, smoking prevalence among people with mental disorders is about 2 to 4 times higher than in the general population. People with schizophrenia spectrum disorders smoke more heavily and are more dependent on tobacco cigarettes than those without mental illness. And as a result of high smoking rates, people with mental health conditions also have high rates of morbidity and mortality from smoking related diseases. So yeah, if people are self-medicating essentially with nicotine to alleviate some of those symptoms, or however nicotine is helping people, there are safer ways that people with schizophrenia can consume nicotine as opposed to just smoking.
Yeah.
So awesome. Yeah. Sorry, I kind of jumped the gun there, everybody. On closing out, but definitely good, solid research there. It is in the blog. There's also been some links dropped in through chat as well, directly to that. So if you missed those, it is in the blog. Most of the things that we discuss here on the program they'll be available in this week's blog, and we should have links to that as well for all these videos when they go out and they get saved as replays for Facebook, YouTube. That should be available there as well, so you'll be able to read through as you watch. If you're here for the replay, thanks for joining us for the replay. But I guess maybe that is where I guess that's where we end it. I guess that's where we're going to wrap up for the week. What do you think, Alex? Do you have anything else
questions
to add to this? Do we have questions from chat? I don't know. Here's one that I'd like to hear you take a stab at.
All right.
Why can Big Tobacco continue to sell a product that contains 27,000 carcinogens? Okay. Actual ingredients that are proven to cause cancer. Why? I want to hear you take a stab at this.
Okay, so a note about the 27,000 carcinogens. That number changes depending on who you're talking to. I think it's somewhere between like 50 and 100 actually. Yeah. The compounds found either as part of the ingredients or that occur as a result of combustion. And it's certainly thousands of chemicals that once you set it on fire, more and more and more. So here, cigarettes are essentially protected. That's a result of the Family Smoking Prevention and Tobacco Control Act, which we just shortened down to Tobacco Control Act, or TCA. It's no secret. Passing that act was a negotiation between the activists, the anti-smoking activists, Congress, and the tobacco companies. And tobacco companies got kind of a good deal out of this. The regulation is set up to do just what we're seeing now. Some folks would call that just sort of a consequence of trying to regulate things properly. But really, what happened almost immediately for cigarette companies was they lost the ability to freely introduce new and exciting products, which is, as folks in the vapor industry know, when we talk about the hype juice or all of the hype that was around, different devices and everything, every month you'd have a new thing coming out, and it drove a lot of excitement and a lot of interest in in the products in the industry. So the Tobacco Control Act took that away from them, but it also took it away from their competitors or any would-be competitors. And so it became way more difficult to really compete with the larger firms for market share. And that's why we have, basically Reynolds and Altria trying to, well, I think it's Reynolds and whoever else trying to duke it out for second place. But that's kind of what we're stuck with. I would love to think that lawmakers were forward-looking enough or steeped in enough American history. You don't have to go further than your backyard in the United States to figure out how bad prohibition is in this country, whether you're talking about drugs or you're talking about alcohol, all of which drugs
are drugs.
So it doesn't matter. I mean, it has never worked in this country. It has led to much larger public health and public safety disasters. It has widened the gap between the haves and the have-nots, or the have not so much. And I would like to think that they were that introspective and aware of our own history, that they said, no, we can't ban the products because it'll just lead to lots of crime and death. Certainly that was part of the discussion about prohibiting menthol. Something people should know, that banning menthol has been proposed for decades. This is, one of those things that they've always wanted to get rid of. So yeah, that's why cigarettes can still be sold, because everybody negotiated about it without you or I having anything to say about it, really. So it gave tobacco companies a bit of a safe harbor.
Yeah. And there's not quite 27,000 carcinogens in a cigarette.
But there are a lot.
Gosh, could you imagine? Anyways, all right. I think now is where we're going to wrap this up, everybody. Thank you. I hope that you guys enjoyed our first CASAA Live. Thank you, Alex, for always doing such a fantastic job. You are a wealth of knowledge, sir, and I greatly appreciate you. And I appreciate each and every one of you for showing up today and being part of this discussion here with us. All of these replays will be available later on. I saw a comment in chat from Dave Berlin asking if this would be a podcast. Yes, the podcast will still be ongoing, and that will be available on SoundCloud and most likely wherever you tune into your podcast, but we always recommend that you follow us on SoundCloud. Yeah, I think that's going to do it. Any final thoughts, Alex, for everybody out there? Quick reminder again, Vape Mail Ban. Please submit your comments by no later than Monday. That is, you can't any later than Monday. That would be the end. So please, if you haven't submitted your comments, please head over to CASAA.org and go to that nifty call to action that Alex took the time to show all of us today. That's it. Those are my final thoughts. Just submit your comments and keep doing what we're doing.
Well, I will conclude by saying thank you, everyone, for tuning in to the first of hopefully many live CASAA updates. Make sure you smash that like button and click on the bell, get notifications when we go live.
Yes.
And please share it with your friends. Thank you, everyone, for showing up.
Smash that like button. Literally punch your computer. No, I'm just kidding, guys. Don't punch your computer. Everybody take care. Thank you guys so much for joining us. Be excellent to each other. And remember that all of us together, we are CASAA. And we will see you guys next time.